Hello, my name is Dr. Gregory Page, and I am a cosmetic and reconstructive dentist, and I've treated a lot of patients, over 10,000, and I have a few things I want to mention. First, I want to talk about erosion of your gums and your teeth at the gum line. So this can be as extreme as grooves in your teeth at the gum line, or just recession of the gum. In other words, the gum starts shrinking up. So even though your gums are healthy, for some reason, they're shrinking and they're not healthy. There's a big truck. Okay, it's gone. It's moving away. Anyway, so I want to talk about what that's caused by. That recession of the grooving and the recession of the gums is caused by grinding your teeth. So what happens is when the teeth mesh together perfectly, the muscles relax. Let's just say that these are your teeth and they mesh perfectly. The problem is if they don't mesh perfectly and they kind of hit like this and then slide, hit and slide, your muscles are doing that. They're trying to wear that down, or for some reason they keep they keep working it. They're working it and working it. Tires out the muscles. Sometimes you'll have pain here. Sometimes you'll have pain here. Those are called, they can even be sometimes misdiagnosed as migraine headaches when they're really caused by grinding your teeth. Anyway, so what happens is the tooth tends to break down right at the gum line, okay? So it would be right at this area right here, okay, right at the gum line. There'll be grooves in your teeth. You'll see them in there, and they can become sensitive. They can cause a lot of sensitivity. By the way, Sensodyne toothpaste doesn't help. A good fluoride does. A lot of people don't like fluoride. They think it's a poison. Well, you're not drinking it. You're placing it on your tooth, and it can have some beneficial effect. Fluoride treatment by a dentist is just for a minute or two, so that's very transient. That's not going to cause brain damage or something. But, you don't want to be drinking things with fluoride in it. Now they found that green tea has fluoride in it, so if you're drinking green tea, so you can't really, totally say fluoride's no good, and it's some risky thing. It's just you need to use it properly in the proper amount. Anyway, so you get this recession at the gum. It's caused by grinding your teeth. You can go to your dentist. They give you a piece of plastic to put between your teeth. It cushions the grinding. In other words, it separates the teeth so that that slide isn't happening. It cushions a little bit. And this can be pretty beneficial, and it's a very inexpensive way to correct that. It's just who wants to wear that, that plastic thing. So it has poor compliance. People don't use it. Let me tell you a story. So I had a patient, actually it was a friend of mine and a patient, and so she was an attractive female in her 30s, and what happened was I made her a night guard because she was grinding her teeth and she had a lot of recession and and grooving and damaging of her enamel. So of course she didn't wear it. So then what happened was she started having migraine headaches. It was really bad. It was ruining her sleep. She couldn't function properly. She was having problems at work. So she went to the doctor and they said, okay, we're going to do all these scans. So they did all these MRIs. I think she spent like $20,000 or $30,000 on all these tests. Okay. I mean, some of it was covered by insurance, but it cost her a lot of money, thousands of dollars for all these tests. And they said, no, we can't find anything. So then they go, you got to go see the psychiatrist, because we don't know what it is. So then the psychiatrist is like, this guy was actually, rather than just putting her on drugs, he goes, from what your symptoms are, have you ever been told that you grind your teeth? And she goes, yes, my dentist told me I grind my teeth and made a night guard. Now the night guard I made for her was, I think, $300, right? Anyway, so he goes, what I would recommend is you put that night guard in and see if the headaches go well. Well, sure enough, she put the night guard in and the headaches went away. Now that was about a year of her going back and forth to all these doctors, frustrating, worrying, and all that stuff, if she would have just worn the night guard. So the problem with those night guards is nobody wants to wear them, especially in your 20s and 30s. It's like, you have some attractive person that you're trying to build a intimate or long-term relationship with, and then you pop that thing in. It's the end of that relationship. Okay, so I just wanted to mention that. So this recession is caused by grinding. Grinding can cause headaches. Grinding can cause breakdown of the enamel with the gum line, and it can cause problems with the gums because, you know, the tooth is like a fence post in the ground. So if you have let's say this is the bone around your tooth, and you have the tooth in there, and you're constantly wiggling it like that. What does it do? It breaks down the bone and the gums that attach to the bone. It's just like dirt around a fence post would become, you know, it would break down and kind of spread apart, and, you know, right where the fence post goes into the grounds, right? Because it's so that's what's happening with your teeth when you're grinding your teeth, or you're hitting one tooth and not the others evenly. Now you can have this corrected if you find a really good dentist. There's not a lot of guys that treat this, you know, and that's the problem. If you contact me, I can help you with it. But anyway, let me go over, this is my favorite toothpaste, Arm & Hammer. This stuff works great. A lot of dentists are saying, hey, it's abrasive. I don't agree with that. I really don't. I think if you're brushing properly with a proper brush a couple times a day, this is a great toothpaste. So, I don't know, my phone is telling me something, but I'm going to ignore it. Okay, I'm going to show you quickly how to brush your teeth. I have this little fancy toothbrush here for demonstrating. Okay, so what you want to do is you want to angle the bristles of the brush at a 45-degree angle between the tooth and the gum, just like this. Notice half the bristles are on the tooth, half are on the gum, and you're just wiggling. These bristles are going to work under the gum and clean the place where food and bacteria trap, okay? So what you're doing is you're wiggling and you move it. Wiggle, move, and you work your way around. But you also have to do the tongue side of the teeth. So you wiggle, move. In the front, you can do it like this. In the front, you can do it like this, or you can go like this. Either way is good. But it's that seam between the tooth and the gum. Now, if you're using floss, use a nice big piece of floss, go around your middle fingers like this, and then guide with your index finger. And then what you're doing is you're going down between the teeth. You kind of get the floss to wrap around and act like a knife edge to pull off the tooth. Okay, that's what works really good. Now look at my other videos, because I have some good close-ups of this if you're interested in this. The problem with flossing is this. Flossing takes time and coordination. The first time you do this, you know, you're going in like this all around between all the teeth. It's going to take you 10, 20 minutes to do the first time. If you do it every day, all you need to do is one time a day. I mean, sure, 3 times is way better, but practically speaking, if you do it once a day, man, it's going to really keep your teeth clean. The best time is before you go to bed at night, because then your teeth are clean all night long, rather than if there's bacteria in your teeth at night, they're giving off acids and dissolving your enamel all night long. Okay, so anyway, the problem with flossing is it takes a bit of coordination. If you do it every day for about a week, you're going to get fast at it. You can do it in a few minutes. I have a real good friend. He does it like when he's in the car at stoplights, which I don't recommend, you know, doing it when you're driving. I mean, you should be driving. Anyway, but he does that, and then he tosses the floss out the window. I go, dude, man, what, you know, what about pollution? He goes, pollution? The birds love that stuff. They make nests out of it. I'm like, okay. So anyway, that's my friend Richard. He's kind of a genius, but I don't know. Sometimes he's, you know, we all. Anyway, so the situation is, if you want something that's almost as good as flossing and brushing, but it's faster and easier, buy a Sonicare toothbrush. Those things are great, man. They're almost as good as a dental cleaning by the dentist. They're not as good, but they're almost as good. The real value of going to get your teeth cleaned every 6 months by the dentist, or once a year now, they're recommending for people with meticulously clean teeth. The reason you want to do that is because that way the dentist inspects your teeth, takes x-rays. X-rays are really safe right now. The radiation's really low with these digital things. Everybody's worried about radiation. No, man, dental x-rays are so safe. I mean, anyway, so they check your teeth meticulously for early decay, and then they fill the filling when it's very small. It doesn't hurt as much. It's not as expensive. It lasts longer. So go to the dentist. I mean, it's a good thing to do, especially in the United States. If your dentist is doing metal fillings, find a new one. I mean, you know, I've been doing, you know, white fillings for, you know, over 20 years, and anybody that's still doing metal fillings, I mean, they're in the Stone Age, you know. So anyway, Sonicare works really good. Now, if you're looking for something, oh, by the way, with the Sonicare, just get the travel model. It's really a great. It's the same thing as the regular one. It just doesn't have all the accessories and the bells and whistles that you really don't need. All you need is the basic Sonicare toothbrush. So the travel kit, it's less expensive and it works great. It's really a beautiful little piece of equipment. Now, if you want to save some money for half the price, or I think even $10 or $15, look at my store. I'm going to open a store in the next few weeks. Anyway, get a Colgate Spin Brush. Man, those things work great. And again, use it half on the gums, half on the teeth, at the surface of the teeth. Now, especially for kids, if you're eating a lot of carbohydrates or sweets, that stuff traps in all these cracks and grooves of the teeth, right? And it sits in there, so you get decay. Why do you get decay? Because bacteria eat the sugars, and then the bacteria give off acids, and the acids dissolve your teeth. So it's not the sugar that's dissolving your teeth as much as it is the acids given off by the bacteria. That's why you want to keep the teeth clean from bacteria with flossing. Sonicare also will get rid of bacteria, loosen it up from the attachment to the tooth and then wash it away, so that they're ineffective it's when they attach the tooth and they give off their acids that causes the problem. So anyway, kids need to clean those grooves in their teeth. That's what's important for kids. For adults, you want to clean the seam between the tooth and the gum. Anyway, so you want to brush, especially after carbohydrates or sugary foods. Again, I like Arm & Hammer. The other thing I was recommending was a Colgate Spin Brush. Again, you got to do the inside of the teeth, in other words, the tooth, the gum side, the tongue side, as well as the cheek side, okay? And use that 3 times a day. Oh God, that's unbelievable. Once a day is even good. So that's what I recommend. If your bite is off, you need to get that taken care of in one way or another, because that can damage your teeth, that can damage your gums, that can give you headaches. And if you're having all those problems, find a dentist that'll fix it. I mean, if one guy won't do it, go to somebody else, get another opinion. The other thing I want to talk about is bubbly drinks. Okay, these are your, any tonic water, sparkling waters, Perrier waters, all that stuff. The way they get it to bubble is they put what's called, even Coke, any of these soft drinks, I guess they call them, they all have bubbles in them. And the way that's not natural. I mean, they put carbonic acid in there. And carbonic acid is an acid that's very unstable. So if you just shake it up, it breaks down into water and oxygen. So that's where the bubbles come from, okay? And that's why your drinks, when they're flat, taste watery, because the carbonic acid broke down to, the bubbles, gave off oxygen, and the carbonic acid becomes water, and that makes your drink taste watery. Okay. The real danger for carbonic acid in your drinks, or any drinks with bubbles, is that carbonic acid gets into your system, and then it gets into the inside of your teeth, and it dissolves your teeth from the inside. I've seen this clinically. I don't know that there's a lot of papers on it. I'm sure there are, but I've seen this, and I've treated over 10,000 patients. Anyway, so it's the bubbles in the drink. So even if there's no sugar in the drink, if there's bubbles in the drink, it can damage your teeth. Now, if you drink a bubbly drink, one of them a day, 12 ounces, your body will process that. The only way your body can get rid of that carbonic acid is to combine it with calcium. So it's pulling calcium out of your bones and your teeth, okay? So the point is, the people that are sipping carbonated drinks all day are really damaging your teeth. The carbonic acid is an acid, and they say it'll dissolve the outside of your teeth. I didn't see a lot of that. But what I did see is those people, their teeth from the inside are just like almost hollowed out or soft and weak, and they have like rampant decay. I mean, every tooth, it's like you fix one and then you got another one and another one and another one. So take your vitamins, take good multivitamin every day, take one of those vitamin packs every day, and limit your carbonated drinks, and it'll make your teeth and gums a lot healthier, a lot healthier. And it's easy to do, it's inexpensive, and the vitamins are good for your general health. I used to do a lot of surgery, and I used to give patients reconstructive surgery. You know, healing is an important aspect of that. If you can't get people to heal, surgery is really no good, you know. So you got to kind of judge if the people can heal. And then what I would do is I would, you know, stack the deck a little bit, and I would give them a big bottle of multivitamin. I go, you start this for a week before the surgery and continue it until they're gone. So it'd be a month's supply. So, you know, after that surgery, they didn't really feel like eating, so they weren't getting good nutrition because their gums hurt, and they're getting all these implants, and they couldn't really chew good, so their food would go, you know, they all lost 10 pounds. I mean, but if they would take those vitamins, the healing was really exceptional. So if you're taking vitamins, your whole body is going to be healing and responding and recovering faster. So take vitamins, man, yeah. And especially if you're having any kind of surgery, I think start a week or two or a month before, go for a month after, and just take them every day. What the hell? You know, eat high protein, high fat diet with vitamins. That's what I do. That's what I do. I eat like high protein, high fat, and then I just dump vitamins on top of those and nutritional supplements. Someday I'll talk about that. Anyway, good. The carbonated drinks, it's the people that sip carbonated drinks all day long. They're just soaking their teeth from the inside in their bloodstream in carbonic acid, which is pulling calcium out of the tooth. It's a demineralization process. The calcium bond in the tooth structure is very strong and resistant, just like it would be in bone, okay? It'll also pull the calcium out of your bone. The easiest way to build up strong bone, stay away from too much carbonated drinks, and go for a walk for 20 minutes every day or 3 times a week, and your bones will be so strong. I think that's why a lot of these middle-aged women, they kind of get into their Lexus and drive around, and they need to walk. You need to, you know, don't shortcut it. Go for a walk, talk to your neighbors, walk around the neighborhood, look at things. It's a very healthy way to live. Anyway, that's enough for me for today. This is my 3rd live. I don't have my fancy doctor outfit on today with Dr. Page on there, but I am a cosmetic, actually I'm a dentist, general dentist, licensed in the state of Illinois. I did a lot of cosmetic dentistry, a lot of implant dentistry, reconstruction, and I'm going to talk more about vitamins and nutrition. Take a look at my site. I have, sometimes I will share other people's posts on my page, and you should read those because I know those work, because clinically I was treating patients for years and years and years, and I had to read all their medical histories every time they came in, you know. So I followed medical histories for years, and I've seen what works and what doesn't work. And you know, these minerals, man, they're a real problem. There's a real deficiency of minerals in the American diet, and too much of this high fructose corn syrup, that stuff just changes to fat. It doesn't even give you any energy. It just makes you hungry. You get really, there's actually some scientific data that says when you eat anything with high fructose corn syrup, stay away from that stuff. Read the package labels and stay away from anything that has that in there. When you have high fructose corn syrup, it changes to fat, so you get like a fat that won't burn off because that stuff, you know, it just doesn't burn off. And then there's a hormone released from your brain that you're still hungry. So you're just eating that stuff constantly, man. It's like a heroin addiction, you know. That's my, you know, my own personal viewpoint. That's not any scientific thing, but stay away from that high fructose corn syrup. Eat fresh fruits and vegetables. Go with organic fruits, especially because, you know, all those chemicals get on the skins of those, you know, blueberries are so good and with breakfast in the morning. But, you know, get the organic ones because it doesn't have all those pesticides and chemicals on there. You know, I mean, like avocados, they have that tough skin on there. Maybe the pesticides are okay on there. You know, it depends. But I'm going to talk more about that and see some of my posts of the other, you know, people that are posting on TikTok, because I'm, you know, there's a lot of misinformation on TikTok. So I'll edit out that misinformation, and I'll protect you, so you're not like taking some stupid thing that's like a waste of time or money and causing you problems. And just, you know, listen to some, follow my site. Please comment. Of course, that helps me a lot. Share anything that I have on my page with your friends, because they'll learn something. And I hope to see you again soon. And bye for now.